a systematic review is an overview of all of the trials and all of the quality studies that are done in an area. Oftentimes, someone will get an idea and say, well, why don't we test this drug in this type of patient to see if it has this kind of effect? Good question. The first thing you need to do, though, is ask, has anybody else asked that question? Have they studied that in Israel or in Argentina or in Russia or in China? Because studies happen all over the world, and it makes much more sense to spend the time to do a systematic review. And sometimes the systematic review answers the question. You don't actually have to study that because it's been studied in 6 other trials, and here's the results they found. So a systematic review can actually save money because you don't have to replicate things that have already been either proven or even disproven. It is a scandal that systematic reviews aren't done as often as they should be, because so much of our tax dollars is being wasted on studying things for which there are good systematic levels of research which show that research is probably unnecessary or likely to be completely useless. Systematic reviews, and the thing is, it's not sexy science. It's not like finding a gene or a new metabolic pathway or a new pharmacokinetic activity of a drug. That's high-level research, as bench research. That stuff is really interesting, and it's very expensive to produce, and it's sexy, and it gives people good things to put on their curriculum vitae. But at the same time, research should be serving humanity, and those questions that researchers have, if they aren't supported by systematic reviews, it shouldn't be done. It's very difficult to challenge our doctors, and we don't have a lot of time. If you're in a clinical encounter, an office visit with a physician, and they're diagnosing something to you, maybe you've got high cholesterol or high blood pressure or high blood sugars, or maybe they've tested your bones and you've got low bone density, they might want to jump into a treatment right away. And I think what is a very good question to ask is to ask the physician to summarize what is the evidence of the benefits and the harms of whatever they're proposing to give to you. And some of them are not going to say, we don't have time for that. Well, that's when you stop and say, well, you would be a fool to jump into a treatment just because he told you it was good without summarizing the evidence. And some doctors are really good at saying, okay, here's what the studies say. I know the studies. Here's the potential for harm, and here's why I recommend it. Honest doctors are going to do that. And also honest doctors are going to say, guess what? There is a lot of uncertainty. We don't actually know. That I said there's that big pool of uncertainty behind medical treatments. And if there is uncertainty, I think people need to know that. People need to know that what they're proposing has drawbacks, it has costs, it has possibly benefits, but they also know that if there's uncertainties involved. And I think something like cholesterol lowering, for example, you've got healthy people who are being prescribed, who have been told that they've got high cholesterol, they're prescribed a cholesterol lowering drug, and then without even asking, what is the evidence of benefit in me or a person like me? And I think an honest response to that is that there is a huge controversy in the cardiology world between those who propose that healthy people with high cholesterol should have it lowered with statins, and there's others who are saying healthy people with high cholesterol shouldn't be taking statins because of the very low level of benefit and the potential for harm. And if there's uncertainty, I think a good doctor should be able to explain that to a patient. So let me give you the best example of an expert giving an advice. So probably the widest selling health book, possibly in the history of the world, was a book written by a guy named Dr. Spock. It was a book about caring for babies, childbirth and child rearing. wildly popular for decades. In fact, my mother remembers reading Dr. Spock. Well, one of the bits of advice that Dr. Spock gave is that babies should sleep on their front. And his argument was, well, you know, if they have a stomach upset and they vomit, it's better that they're on their front than on their back because they could choke and so on. So that was the rationale. He promoted that idea in his book, and he, you know, as the baby expert, millions of women around the world would follow this advice. The problem was Dr. Spock didn't have any evidence. He had a theory, he had an idea, he was an expert, he was the expert, but he didn't have any evidence until the evidence started to roll in and find that babies who sleep on their front are more likely to suffer from sudden infant death syndrome because you've got sometimes very soft mattresses and very soft covers that babies on, and they can smother if they're lying on their front. It's better, actually, as we found out through research, it's better to put the babies on their back. And I asked my mother, when I was a baby, did you put me on the front, as Dr. Spock said, or did you put me on the back, on my back, as the evidence now shows the right way? And she said, I always put you on your back. It just made more sense. So why didn't you follow the advice of Dr. Spock? Well, I don't know. She had a mother's intuition that overrode the expert. And I would never want to downplay the importance of a mother's intuition when it comes to caring for her children. So again, if the experts are telling you to do something, you need to ask, where's your research? And if people had asked even earlier, Dr. Spock, is this an evidence-based recommendation? And if they found out that it wasn't, maybe not many babies would have died from SIDS.